all the snow for you and get you through this wintry pattern when I come back in a few minutes.
All right, thank you, Jay. Well, we now have the highest number of flu-related hospitalizations in more than 8 years. The CDC says there are still no signs of slowing down for the flu season, but there's a good number of patients who think they have the flu, but they really don't. 13 ABC's Melissa Veitch explains.
Well, Christian, the other virus hitting patients very hard is called the adenovirus, and it can take you off the grid for a couple of days. Luckily, in most patients, though, it's not as serious as the flu.
Just look in your throat here.
ProMedica nurse practitioner Josh Whitmer says adenovirus and the flu are very similar.
Adenovirus tend to be a little bit more mild than symptoms of influenza. Also, with influenza, the symptoms come on very abruptly and they're very severe.
Adenovirus symptoms come on slower and they're not as severe, starting with a lower temperature.
Generally, the symptoms of adenovirus are more they can have a little bit of sore throat, mild body aches, runny, itchy, watery eyes, which often mimic the flu.
The challenge is that even for doctors, sometimes it's hard to tell without a flu test because treatment for each virus is different. Tamiflu is given to flu patients to reduce the symptoms. Adenovirus is symptomatic.
If the patient has a sore throat, maybe help them with, give them some kind of analgesia for their sore throat, or, Tylenol, ibuprofen, something like that for the body aches.
Besides good hand washing and disinfecting of common surfaces, it's really tough to get rid of adenovirus because it really is only killed by straight bleach.
Honestly, it lives on everything. Unless you're terribly meticulous, I don't know that it would probably kill all of it.
Some other telltale signs that it's the adenovirus and not the flu. Adenovirus comes with pink eye sometimes in some cases, and laryngitis. That is a look at what's going around. Melissa Veitch, 13 ABC Action News. Back to you.
All right, Melissa, thank you. In Columbus, a rescuer had to be